Puja.
Hi, Sanjana.
Thank you for coming on my podcast.
You're welcome.
What are you going to tell everybody who doesn't know you? Who are you?
I'm Puja from Dallas, Texas, and I moved to Bombay in 2015, after which I met my husband. We got married and decided to create a wellness focused business here. So, focusing mostly on yoga. I found a lot of healing through yoga and the practices. So I decided to turn that into a business. Meanwhile, my husband, Diggy, has taken the charge on flotation therapy, which is something that is quite common now in Western countries. But
you guys were the pioneers.
Yes,
here.
Here for sure.
Yeah.
For sure.
Yeah.
So I think with the combination of both things of yoga, which is supposed to be movement oriented, and then you have flotation, which is very stillness oriented.
No movement.
So yeah, zero movement, complete dead body status.
When I came. It was a good feeling.
So we started this wellness oriented business, and I consider myself to be a wellness entrepreneur, yoga educator. I teach prenatal yoga. I also teach a lot of pranayama and meditation, which is a part of yoga. It shouldn't be really considered separate. But yeah, so that's me in a nutshell. I'm from the US and I'm living life here for now.
NRI life.
NRI life. Yeah.
You don't vote for Modi, na? You don't believe in Modi.
No.
So you're safe. You're safe.
I don't agree with his politics.
But tell me something, it's interesting that, and I actually, this kind of struck me when you were mentioning it. Do you feel like maybe the health and wellness space now is A, overcrowded, and B, my sense is starting to become like exploitative in a way?
Absolutely. I think
like almost any space is now, but do you feel like...
and I feel like there is lack of... I think there are a lot of initiatives in Western countries where they're trying to unionize yoga teachers, right? Because when you unionize, you naturally get a set of standard. Not only are yoga teachers meant to get a certain level of education before they start teaching the practices, like just a regular 200-hour teacher's training course to be a yoga teacher, is that enough? So I feel like in India, there really does need to be some sort of set rules or guidelines on who can become a wellness entrepreneur, because it does seem like there are so many of these wellness coaches and life coaches and I don't know, this, that healer, and I don't know what all nonsense is going on out there. But not to say that just because I don't understand it doesn't mean that there's some merit to it.
Yeah.
But I feel like a lot of it is exploitative in nature, because until it became mainstream and norm, or the norm in the West, it wasn't really accepted here, right?
Yeah.
I mean, in the West, it blew up: yoga, meditation, all these different kinds of, I don't know, chakra healing and this, that healing. And then all of a sudden, Indian people are kind of...
Open it all up.
Yeah, they're like hopping onto the bandwagon.
Yeah.
And just kind of like, oh, let's we can... I mean, but
go back to our roots.
Go back to our roots.
Yeah, I feel your vibe. Yeah, I understand where you're going with this.
Politicizing something like yoga is also happening over here, by and large, by the government, trying to claim it or reclaim it as a exclusively Hindu thing. And I get
It's called soft Hindutva.
Yeah. Soft Hindutva. And I get a lot of blowback on some of the content I post in regards to that, because I like to take a very scholarly approach to it. And I like to take an open approach. I like to take an approach where we question why things are framed the way they are, and look back to our ancient texts and scriptures to really see, like, where is this coming from? Where is all this coming from? It was meant for a spiritual practice in which you can take examples of who you want your God to be,
Yeah.
and that is essentially, I feel, something that you have to search for within the self.
Mm-hmm.
It is meditation. So I think now the exploitative nature comes mainly from attaching it to a religion, but also on the flip side, it comes from taking it away from its roots because it is traditionally Indian by nature. But like, what was India? I mean, it included Afghanistan, Pakistan, it included so many things
Mm.
back thousands of years.
Yeah.
I also think there's danger there.
Yeah.
Just on the flip side is,
Appropriating it.
yeah, appropriating it. And then on the other side, having Hindus be like, it's Hindu, like yoga is Hinduism.
Yeah.
And to say that all Hindus practice yoga, no. Are all people who practice yoga Hindu? No, definitely not. And I think that that's something that you have to look at, is that not all people who are Hindu are practicing yoga. So if we're going to call it something that's Hindu, then I mean, I don't mean to discredit those people, but I feel like it's always important to ask those questions as to like,
Yeah.
what does this mean? And, why are we so attached to bring it to a religion, right? Because we want to politicize it. We want to
Yeah.
reclaim it.
So you spoke about like blowbacks on social media and like
Yeah.
just
Lots of them.
but I've also seen that on your social media quite recently that you've been pretty vocal about your journey and your struggles
Yes.
with fertility, and
Yes.
I wanted to just understand from you just particularly about like just tell me a little about that, like where you currently are, and congratulations by the
Thank
way.
you. Thank you. I am almost 6 months pregnant. And my husband and I decided that we would go through our process via IVF because it wasn't really happening naturally for us. And the other challenging part is that he lives in Goa, I live here.
Mhm.
So when it would come to like, I mean, we've been living long distance now for 2 years.
Yeah.
So it's kind of like, when does one have sex at this age
Yeah.
on like a planned date, right? We would have to make sure we're in the same city.
Yeah.
And is that happening every month? Because if you're
Are you
on a
ovulating
time,
then?
yeah, are you ovulating? Like, there's a time limit. When we started trying, I was like 35, 36, 37, and I'm 38 now. And then IVF is when they essentially give you hormones to stimulate your eggs, and then you produce eggs. They retrieve the eggs, and either you can choose to freeze just the eggs,
Yeah.
or you can create an embryo with your partner's sperm. So we decided, obviously, if that was the quickest avenue for it to happen for us, let's do that.
Yeah.
So that's kind of what we decided to do. Did you have any?
But I feel like the way you just explained it to me is it does sound lengthy, and I have to admit that's also something that I think most women our age, or even now, I think just most women or people who identify as women are talking about egg freezing, but I feel like a lot of times there's not a real sense or an understanding of how long drawn out and how challenging the process can be for
Yeah.
IVF, because I think a lot of times, and I just think that okay, doctors are like, it's okay, you can do IVF, freeze your eggs, it's fine, but I think just the idea of like injecting yourself may not be like a source of comfort to everybody, or may not be
Yeah.
everybody's thing, and
Yeah.
it really makes you weigh that, is this what I need to do to have a baby? And like I think it also really comes down to the kind of struggles that are not spoken about when it
Yeah.
comes to
Yeah,
women's
absolutely.
reproductive health.
Yeah, absolutely. I feel like, especially here, women do have a tendency to be very hush hush about it, which is why I have been so vocal about it, because so many of my friends who I spoke to when I was undergoing this process, they were like, hey, is this the same process that you go through to freeze your eggs? And I'm like, actually, yes, it's exactly the same.
Yeah.
So the first part of the IVF cycle is essentially the retrieval of the eggs. Now, The injecting yourself, that's a whole different story because I did 2 back-to-back cycles. So because I had low fertility, I had to do something that my doctor recommended, like a longer protocol. So each woman's dosing and how many shots you receive or give yourself is determined by your doctor based on your fertility and based on various other factors that
Okay.
they kind of explain to you. But step one is getting a blood test done where I think they check your hormones. They check something called your AMH levels, which is basically an indicator of how many eggs you have in your reserve, like how many eggs you have left and your fertility. It's a pretty solid indicator of where your fertility is. So if you are having issues conceiving naturally, then the first step is this blood test that your doctor will recommend.
Yeah.
Step number 2 is they will determine whether you are a viable candidate for IVF, depending on your age, depending on how many eggs you have in your reserve, depending on your health and various other factors. So after that, they decide a date that you start your injections and they tell you how long you need to do them for, what your dosing is, and then they give you your injections to take home. So once you take the injections home, it's your responsibility to take them yourself. And usually it's in your hip, like some of them, no, your thigh or your belly. But
what was
for
the
me,
first injection like?
I was really nervous. The first injection, they gave it to me in the clinic because they wanted to show me
Your own, the one that you gave yourself. What was that like?
Oh, my first cycle, the lovely thing about India is that you can hire nurses to come home and do it for you.
Yeah.
So my first cycle, I was a little bit scared to do them myself because I was like, oh my God, it's like so nerve-wracking.
Yeah.
But eventually, as I went along, I just was like, this doesn't hurt. I can probably just do it myself.
Yeah.
And honestly, I didn't find them too painful. I found them really painful when she would want me to do it in my thigh.
Yeah.
I found that to be way more painful than just grabbing the fat in my belly and like injecting it there. I was like, okay, there's a lot of flab here.
Yeah.
So
Yeah.
I was like, I'm fine with that. Whether it's more boochkies in our life or, we choose to adopt, right?
Yeah.
There's always an option for you to become parents.
Yeah.
It's not a one size fits all. But it was nerve-wracking, but I mean, I have a pretty high pain tolerance. So I think it depends on who you are. But typically the ice helps. So you kind of like ice the area and kind of numb it. And then it's kind of like easy peasy. You just get used to it.
Yeah.
It just felt like a little bit of a pinch. Now, I know women that have longer IVF journeys than I did. I mean, they end up having like bruises depending on how easily you bruise. And they end up having like a lot of pain.
Yeah.
Like just kind of the physical pain and stuff. I was very lucky. I did not have any of that. I was pretty balanced throughout. And I think that with the IVF treatments, I just decided to do 2 back-to-back because I didn't want that break. I didn't want that up of the hormones and then that crash and then to go up again. So I was like, let me just do 2 cycles back-to-back. So I did my first, did 1 retrieval, and I didn't get the best results. So then the second time he kind of altered and changed my dose. I think gave me more. I did a little bit of a longer cycle and then I got some more embryos. So the first cycle I got 3. We got 3 good embryos, and the second cycle we got 5.
Yeah.
So, which was great. I mean, and I was lucky that the first time we decided. So once the IVF cycles are done and your eggs are frozen or your embryos are frozen, you can then decide. For us, it was embryos, and you have to let your doctor know when you want to go for your embryo transfer, which is basically when they implant the embryo back into you. And we took a little bit of time after that. They usually recommend a minimum of a month time after your shots before you get the embryo transfer done because you want to make sure that your body kind of levels out from.
And so this egg retrieval is under general anesthesia?
I was completely knocked out for like 15, 20 minutes. It was nice.
Okay.
I love anesthesia because you wake up and you feel kind of drunk, and especially with IVF, you're not supposed to drink or do anything, right?
Yeah.
So it was nice to just feel that little bit of like buzz.
Yeah.
And then, yeah, so it was good. I didn't feel anything.
Yeah.
I had a little bit of abdominal cramping afterwards, but I say generally I was pretty okay. It's
Okay.
pretty strong. And I think it also depends on who your support system is.
Yeah. Yeah.
So I was really lucky that my husband's super supportive and cool and like went and got me Starbucks afterwards, went and fed me and took care of me. And
Yeah.
so we kind of like just took it like it was just a cool thing, fun thing we were doing. And I think both of us are like,
let's inject ourselves.
Yeah.
It can be fun, you know.
Very like science people.
Yeah.
So for us, I was just very amazed
Yeah.
by the process. And also I didn't realize what it meant, but I was like, dude, when they retrieve the egg and then take your sperm and make the embryo, like those 8 embryos we have are like 8 human beings.
Exactly.
8 potential human beings, you know? So it was just kind of like mind-boggling and very amazing for us because we were like, whoa, that's so freaking weird. Like it's such a mind fuck, right?
Yeah,
We're like,
yeah.
dude, we have like 8 children like
Yeah.
sitting in a freezer somewhere. Like we have like 8 babies in a cryo freezer somewhere, which is nuts to think about.
Yeah.
And I also think that the good thing about IVF is another advantage is that when they take your embryos, they grade the embryos.
Okay.
So only the best ones make it. And they usually try to transfer the best ones.
So your 8 best babies are
so
in the
the best, yes.
You guys
exactly.
are so Indian, like such
So-
Indian parents.
Yeah.
Only the best children
Only
are in the
best.
freezer.
Yeah, only the
उससे
best.
ज़्यादा हम लोग accept ही नहीं करेंगे
Yeah.
उससे कम.
Exactly, because they do their own level of genetic testing, and so they really make sure that the embryos you have and the embryos that they're freezing are the healthiest.
Yeah.
If they're not healthy, then they usually discard them and say, listen, you need to try for another cycle.
Yeah.
These embryos are not usable. So they do a certain level of genetic testing on them to make sure.
Yeah.
So with IVF, I think that is an advantage that we have is that, you know, you are getting the healthiest embryos, you know, which I think is pretty special.
Yeah.
So yeah, I think for us, we were quite okay with the process. You know, we were pretty chill about it.
Yeah.
I would say that one thing I've found for a lot of my friends who've undergone IVF is that they've done it during very stressful times in their lives, or they feel a lot of pressure, or they have this whether it's health issues or mental health issues or just this bogged downness by outside pressure, i.e. family, parents, like when are you gonna have a kid? When are you gonna have a kid? One thing I find that does not help and does not give good results is when you're stressed out.
Yeah.
So if you're going for IVF, it's always best to wait until you are in a good mental headspace.
Yeah.
Because any amount of stress when you're injecting yourself with those hormones, and it's already such a tedious, exhausting,
can be nerve-wracking process.
The best thing you can do is take care of your mental health.
Yeah.
Take care of your body, take care of your mind, take care of your heart, and actually just start the process. It's worth to take a month and just say, look, I need to go take a break. Let's go on a nice holiday. Let's just reconnect, right? Because the whole process with your partner becomes so transactional.
Yeah.
You know what I mean? Like,
I know.
You're not like able to, like, honestly, and you're not during your IVF process, you're not allowed to have intercourse.
Yeah.
You know, so you're just kind of like, it's such a impersonal process, right?
Yeah.
It's not like sunshine and rainbows.
Yeah.
So I would say if anyone is going through the IVF process with the intention to conceive with their partner, then it's always good for best results to take a little bit of time and make sure you're in the right mental headspace. Yeah. Because any amount of stress just means that you're not going to get good results in your IVF. Because stress is like the number, like if you're freaking out about it, if you're super nervous or whatever it is, whatever emotions are, if you can't just breathe through it and just kind of go in with a positive outlook, which I know sometimes can be very difficult. Yeah, especially the times we live in. Yeah. Yeah. So it is a difficult thing, but I would say that it's not worth doing the IVF because it is so expensive if you're stressed, right? Yeah. Because you want the best results. It's not a cheap process to undergo. It's very financially, it's an
Draining
investment
and
and
yeah.
it's draining. And literally, like Diggy and I use like all of our savings, things like that,
So
right?
at
So
any
it's,
point were you like, fuck it, man? Like, because at one point you're, you, I don't know how many years, like you guys have probably were trying, and then
yeah,
your finances gone, and
yeah, especially
will
during
be
the
for the couple of
pandemic.
years once your
Yeah,
baby comes as well.
yeah. During
And
the
then
pandemic, it was really difficult because
yeah,
our business was shut.
yeah, and then time
So,
consuming and all of
yeah.
that. At one point, did you just be like, fuck this? It's just
I
not.
think the attitude that we took was I was okay if it didn't work, and
Yeah,
I was okay if it did work.
yeah,
We had both come to terms with, hey, listen, if it doesn't work,
yeah,
I love dogs and I'm obsessed with my dog. He's
yeah,
like my everything.
yeah.
Um, and so for me, I was like, if it doesn't work, I would be so happy just adopting a few
So
more
you
dogs.
literally split your eggs between two baskets, literally and
Yeah, yeah.
figuratively,
And
like
and we were okay, So
yeah,
that's the kind of mindset you have to have. Listen, if it doesn't work, it's okay. We'll
yeah,
explore other options. Diggy and I were also very happy with adoption as an
right,
option.
right.
So I was like, this doesn't mean we can't be parents. This
Mm,
doesn't mean we can't expand our family in other ways, whether it's through
yeah,
dogs or,
yeah,
maybe exploring the adoption route.
yeah,
But both of us were very happy with that outcome. So I think coming to that mindset and understanding what you want as a couple and what's right for you, before you even undergo this stressful process. Like if you're going to go into and be like, this is my only option, I have to have a kid, there's
mm,
no option to fail. That's a lot of pressure.
yeah.
It's a lot of pressure.
I think
And
that's very
women do that.
crucial for like everything in
Yeah.
life to really have that kind of attitude that you're going
Yeah.
to be fine no matter what. I think
Yeah.
that's very, very
Yeah,
important.
and we were happy just with us two as well and our dog,
Exactly. Yeah.
right? We were
Yeah.
happy. Like
Yeah.
I even now I'm having this kid. I'm like, oh my gosh, our relationship is never going to be the same.
Yeah.
It's not. It's going to
Yeah.
be again very like there's
Transactional. Yeah.
transactional. Like we
Yeah.
got to raise this human together. We got to
Yeah.
put it through school. We have to make sure it eats right. We got to
Yeah.
make sure it's got friends. We got to make sure like all these
Yeah.
things that this kid is taken care of and has.
Don't fuck it up too much.
Yeah, exactly. So, I mean, we've decided which ways we want to fuck up our children,
Yeah.
and we're okay with that. But that's kind of what you have to come to terms with,
Yeah.
Like, you have to be solid in your relationship with your partner. You have to make sure that you aren't putting so much pressure on yourself when you're starting this IVF process.
Yeah.
Like, so many women feel like it's like life is over if it doesn't work for whatever reason, right?
Yeah. In this entire process, of course, that you were mentioning, I just also feel like there is just this intense pressure on women, their bodies, their reproductive health. There's either like too much focus on it to a sense of like driving a young woman up the wall.
Yeah.
And then once you're past a certain age, you become an old maid and nobody gives a shit about you anymore. It's like, you did not conceive before you are 30, so now you are doomed. Fuck off. So nobody wants to talk about.
Yeah. I think it's about empowering women with the choice.
Yeah.
I think the pressure is unfortunate because a lot of times women are conditioned at a young age to think that is their only purpose or that is their only
why you have been put on
their
this
only
earth.
their only arc in life, if you will, is that. So I think a lot of women who grow up think that they have to do that. And maybe it's because of society, maybe it's what they see their friends doing, but I feel like it's about what's right for you. And sometimes there are women who honestly, like we know that we were just talking about this, how men suck. And I have a lot of amazing, incredible single girlfriends, women friends who are just not able, they really want to have children.
Yeah.
They see themselves as being or becoming mothers one day themselves, but they haven't found the right partner. So the wonderful thing is that now women in India, as well as women in America, have a choice.
Yeah.
Right? That is if you are privileged enough to afford that choice.
Correct.
So I think it's about having all of your cards on the table and not going into it with ignorance. I find that if it is something that you don't want to do, then express that.
Yeah.
and I feel like a lot of women are afraid to say that they, you know what, I don't think motherhood is right for me. I don't think this is what I want.
Yeah.
Um, as I was saying before, there's like 8 billion people in this world now. So
Yeah.
if that is a choice that you have made, that you're like, listen, I do not want to bring any more children into this world. I don't think this world needs it.
Yeah.
Whatever your reasons are, maybe just even for yourself, that you don't want to go through that process, then it's okay. And I think it's about empowering women to have that choice and to understand what their options are. And I think that's a good starting place.
Yeah.
I don't think we can ever change our parents' generation and thinking that that is our only purpose. But I feel like the change has to start within our generation because, I mean, even my grandmother's generation, my parents' generation, are we ever going to be able to change their mentality?
Yeah.
No. Is that something that we want to put our effort and energy towards? I don't think so. I would
Yeah.
rather,
Yeah.
like I drive myself crazy trying to change the way, my parents think about certain things or approach certain topics. And I think it was just funny. My mom was saying something yesterday, it just randomly came to me. She said, Bichara Modi, like how, and I was like, he is not, I was like, lady, chill. He is like, not no bichara over here. Like,
Yeah.
please. So she said that. I was like, whatever. I'm not even gonna. I just
Yeah.
laughed at her. I was like, he is not a poor Modi. Like,
Yeah.
please,
Yeah. Yeah.
please, like, spare me. So I was like, spare me the cringe. But you know what I mean? Like, we won't ever be able to change their mentalities on certain things. So why put your energy there? But where we can put our energy is by empowering ourselves with the right information, choices, and also the strength to tell people to fuck off
Yeah.
when it's not what you want. If
Yeah.
that's not what you want for yourself, or maybe it's even, I have a lot of friends who are actively trying to date, find partners, but after this post-pandemic lull, it's so much harder to
Yeah.
find a partner. There's a whole energy shift after the pandemic. I do not envy my friends who are online dating right now and going through this, but it's really hard, So I think it's having the strength to tell people to fuck off when it's not right for you and it's not in the cards for you. Whether you're trying or not trying, want to have kids, don't want to have kids, it's up to you, and really just owning that choice.
Yeah.
And knowing that, hey, if I do change my mind one day, these are my options.
Yeah.
I have one of my best friends is actually, she was talking to her parents. She's like, listen, I'd really like to find a partner, but it hasn't happened for me. I'm really successful in my job. I own my own house. And she's actually looking at fostering.
Yeah.
And in the US, the foster system is very messed up.
Yeah.
And she was like, I would love more than anything to adopt and foster a older kid so I can provide that stable household, that stable home.
Yeah.
Because she always saw herself as a mother, but it comes in very different forms.
Yeah.
You're still a mother to your dog, your
Yeah.
goldfish. You can still act as a mother figure to your niece or your nephew.
Yeah.
That doesn't go away. If that's something that you really want, I find that there are mothers now come in various forms.
Yeah.
I myself, now I have a mother-in-law. My mother's sisters are very much like my mom. All of my dad's sisters are very much like extensions of my mother.
Mm-hmm.
So I find that motherhood comes in a lot of forms. Just find, if that is something you want, find which avenue is yours to claim or to explore.
So you spoke a lot about, I think, privilege, which is something that I also wanted to touch upon, because IVF is not cheap.
It's not.
It's really expensive,
not.
and perhaps, like you said, I feel like even the choice then comes with a certain amount of privilege, right?
Mhm.
Because you have this choice because you have the privilege. Because say if you are somebody who is younger or not from the same economic background, or like, or even single for that matter, I can't imagine the kind of struggle that you would have. And I think that also makes it doubly difficult, and maybe it's time for us to also speak to that sect of women.
I think that that's a really difficult one, because I know in the US, if you're working full time and you're single, then there are a lot of options for you, whether it's through healthcare insurance providers that are now covering IVF through, through work. There's that aspect of it. Um, I wish I could speak from that perspective,
Yeah.
but it's really just not my experience. So I would not know what it's like,
Yeah.
and I can't imagine not having that privilege.
Yeah.
I was very blessed with family and people around me that support me and support my
Correct.
decision.
Yeah.
But not everyone has that. And I think that I don't really know. I think like, how do you speak for that?
Yeah.
How do you speak for that?
I think it's just then crucial to just really push for, or in some ways be that support system for
Yeah,
somebody that needs it.
absolutely.
Like, but yeah, but I think that's like a legit concern, because
Yeah.
I'm always grappling with that, because
Yeah, absolutely.
even if you were to get pregnant naturally, that's what they call it. By the way, they call it's either C-section or natural birth.
Natural birth.
And I'm like, fuck, are you trying to say that I gave, like, is it unnatural, like,
To
to
have a
like C-section?
C-section?
Yeah, but this vaginal.
Because
Vaginal. But my point
did you have
is,
a vaginal birth or
no, I had an emergency C-section.
Oh man,
Because I got
I'm having an
induced twice.
elective C-section.
Yeah, but it's good now. At least
Like,
yeah.
Yeah, I'm 38. I
Yeah.
already like pee a little bit when I cough. Like I ain't trying to destroy my pelvic
Yeah,
floor.
don't.
No.
I got induced twice, and he was like, I'm not coming. Just sitting. Like he is right now. It's like, I'm not gonna go anywhere. Yeah. So
He's so
literally,
chill.
I
He's
was
so
like,
chill.
"Please
He's like,
come
I'm
out."
happy in here.
Yeah, then finally my water broke.
Swimming around.
Yeah, and then I had no choice, because his heart rate was like going up. So I was like,
Oh,
get out.
yeah.
But yeah, I always wonder about that, because even pregnancy is not cheap.
No.
It's not. Doctor's visits, the medication, the blood test, it's
Yeah.
not cheap. Delivery is not cheap.
Mhm.
None of it. And I don't know whether
I think in India, when I used to do work with that foundation,
yeah.
I think for people that are from different socioeconomic status, the good thing is that the doctors at the government hospital, yes, they are very, very crowded and it is very hard. But if you do avail a lot of the services and the government schemes and things they have available, you just have to have a social worker there to help you, because many of these people don't read, they don't write, they're scared, they don't know what resources are available to them. That was one thing that I was actually very impressed with when I came here, was that if you just ask in your hospital, that what resources are available for me, as as someone who doesn't have the money to pay
means,
or the means to support this pregnancy financially, then the great thing is the government hospitals have amazing doctors here. Like I worked with them because they see so many people a day, right? They're in fight or flight, like constantly, like all day, every day, seeing hundreds of patients in their OPD, one after the next, after the next, after the next. I think that is really a public health concern that needs to be educated to the rural population, that these resources are available at your government hospital, your regional hospital. So I think that's one thing that I was quite impressed with here, but obviously that does not come without its faults or flaws. And
and there's also, I think there is just a larger and this tends to happen with the middle and the upper middle classes, just like a general distrust at anything government related, when actually Maharashtra has a very, very solid public health system. And we saw that during COVID. They do. It is very solid. And I think if I were to ask you, like, just as closing, like, what would you say? And this, again, I do understand that we say this from a place of privilege, because there are also so many women who have the privilege and still don't have the voice. If I were to ask you, what are like the top 3 things that you would say to women who are struggling in their fertility journeys, or like who are mulling IVF, like what would you say to them?
I would say, number 1, gather all the information you possibly can from credible sources. I started with Google and Reddit, but it's easy to go down
Yeah.
Reddit rabbit holes.
Yeah.
But with that being said, after that, I booked appointments with fertility specialists. I spoke to my friends openly
Yeah.
about it. That's number 2.
Yeah.
So number 1 is get all the
And the fertility
information you can.
specialist in Bombay, who would you recommend?
Dr. Jatin Shah.
Jatin Shah.
Yes.
Okay.
And
Jatin Shah.
yeah, and I really appreciated the clinic, the hygiene. I really liked the fact that I didn't, when you go to a lot of these hospitals, you have to go to one department for this, then they send you to this department, then you have to go to billing separate, then you have to go
Yeah.
here and there and everywhere. This was one clinic for everything. And I really liked that they were so professional in their approach. I didn't feel like I was left with many questions. They answered all my questions. They were very prompt. So I really appreciated that. And for me, seeing a clinic that looked a lot like a clinic that I would visit in America
Yeah.
was important. The hygiene factor, the professionalism, the way the staff was so helpful and caring. Those are all things that are very important. So number 1, have all the information. Number 2, I would say speak to as many as women as you can, because you'll be surprised. When I started my IVF journey, I had like 2-3 cousins that I had no idea who went through IVF, who were like, oh, I did IVF too. And I'm like, why are you telling me this now?
Yeah.
But
yeah.
it was also because I had never,
You never paid attention
I never
at that
paid
time.
attention, or I never really spoke about, hey, like I'm 35. So I would just say,
I'm obsessed with looking at strollers right now. And I'm like,
Yeah.
why didn't I notice this before?
yeah,
Why?
Yeah.
Wow, those have great wheels. But yeah.
great wheels. I think in Bombay
Yeah.
you need great
Yeah,
wheels.
exactly.
You need really good wheels for the potholes. And yeah, so I would say number 1, information. Number 2, speak to your friends and other women that have had children, or just speak to your friends about it, because you'll be surprised who is also thinking about that same thing.
Yeah.
It's always important to have a support system and to also empower one another
Yeah.
to just explore if that's something they want to do. Number 3, make sure you have a good doctor. Make sure it's someone
Yeah.
you trust and you gel with,
Yeah.
and that you are not feeling doubtful about someone.
Judged.
Yeah, judged, or someone that leaves you
Paranoid.
feeling paranoid. I had a couple of experiences with some fertility specialists where I was like, this does not feel right. I don't know what's going on. I don't know what they're doing. I don't know why I'm being asked to take so many blood. Like every time,
Yeah.
she would ask for like different
Blood
blood
work.
tests,
Yeah.
and I'm like, why didn't you just do this in the first time? And why am I
Yeah.
doing it again 2 weeks later? There was no real reason for stuff. So I like the process oriented. So you just have to find someone that works with you, that
Yeah.
works for you. So yeah, I think those are the 3 pieces of advice. And I would say another thing to add on to that is don't feel scared to talk about these things openly.
Yeah.
Because we really just need to support one another, empower one another. And the more people you talk to, the more commonalities you'll find.
Yeah,
I think
exactly.
so many women are so cagey about it and so scared to discuss it. The fact of the matter is, women are having children later. They are finding partners later, maybe even not.
Yeah.
So it's just natural where most women are going to need some kind of help as they approach 35 and above.
Yeah.
That it's completely natural, because there's so many of us in that same boat. So yeah, don't be paranoid to speak to your friends
And
about
when it comes to the expenses, like how is the breakup? Like, do you pay everything in one shot, or is it like?
So as I said, the first doctor I went to, it was very unclear. Like, she basically was like, do you have a pen and paper? Let me write it down. And then when it was coming to it, she'd be like, oh, but then we have to do this too. Then we have to do that too, which I didn't really like, because I was like, this is expensive.
Yeah.
Every time you're making me do this full panel of blood work, it's another 10,000 rupees.
Correct.
Right? For a full panel of all this.
And a
random
cycle
stuff
is
you
like
look to.
2 lakhs. We're looking at.
I'll be honest, mine was in between 4 to 5.
Damn.
But that was one cycle. But with that being said, mine was also kind of a different situation. So your cycle's cost will will
Very.
vary and depend on your dosing, how long the cycle is, um, how many cycles you like. Let's say the first one is
Yeah.
probably like a standard cost, but again, it's going to vary on what your dosing is, right? Because
Yeah.
I think the hormone injections themselves are the most expensive part. And obviously, the hospitalization and the procedure is the next expensive part.
Right.
So, yeah, I would just say make sure you have, and there are doctors that do it for 1 to 2 lakhs as well.
Yeah.
I was privileged enough again
Yeah.
to go to someone who I thought was the best of the best because I
Right.
didn't really have time to waste. So I was like, let me go to the guy that I know who has helped
Yeah.
so many of my friends get pregnant
Yeah.
and I know will do right by me.
Yeah.
And the good thing about mine was that the first embryo transfer, we got one
Yeah.
singleton pregnancy out of the 3 embryos that were
Inseminated.
transferred
Yeah.
and
Yeah.
inseminated. So that's good. So for me, I feel very blessed that that worked the first time. Most people, very many women, it doesn't work the first time. So
Yeah.
your cost will also depend on how many embryo transfers you have to have. So for me, mine was in between 4 to 5 per cycle,
Yeah.
just to be completely transparent and honest.
And like, is that broken up across like do you pay that in installments, or is it just like?
You can. They were very nice to,
Yeah.
say, I was like, can I pay this much now and then
Yeah.
this much 2 weeks later,
Yeah.
when
Yeah.
we're completing the
Yeah.
cycle. And most doctors will allow you to take a payment plan. I know in the US there are financing options. I think maybe in India there are some financing options as well,
Yeah.
but I think it's harder here. Over
Okay.
there, I know that there are financing, like medical financing options. Like if you need a procedure or surgery, then it's almost like a medical credit card that they
Yeah.
give you, and then you have to pay like monthly
Did
installments.
he not check then whether it was available, like whether there was insurance
We
that was
tried.
covering?
I'm covered by insurance here,
Yeah.
but unfortunately,
It doesn't cover.
no, does not
Okay.
cover. Which I think is also another. When we go to that conversation about privilege, I think that's a really amazing way that we can maybe help people who are not as privileged or don't have the financial means
Yeah.
to have children or to go through this expensive process, is by maybe lobbying with the insurance companies, and policy
Yeah.
to really make this available to women far and wide
Correct.
as an option. So I would say that that is something that I would find to be very interesting and like a cause that I would love to help out with. But let's see. I think medical insurance in India also has a long way to come.
Yeah. 100%.
So, yeah.
Okay. And thank you so much.
Thank you for having
And
me.
I wish you the very, very best.
Thank you.
Get lots of sleep. I don't know why people say that to pregnant women.
Oh, because
but
I
think,
don't sleep very much.
No, but also because you don't know what's gonna come after that.
Yeah.
So yeah. But I don't want to be like, I want to kick the cynicism out. Like,
Yeah.
oh, just wait for it.
Oh, everybody.
No.
They're like, just you wait. And
Bullshit.
I'm like, I guess
It's amazing.
whatever.
Every part of it is,
I'm like,
is
whatever. I don't see it like that.
it's fantastic, and I
Yeah.
think it's I'm not like kind of invalidating the dark
struggle
and
and
isolating part of it.
Yeah.
But if this is something you're on board for, it's fabulous. Thank you.
Thank you for having me.